Hey, everybody. See folks trickling in. We are going to hang tight for a minute, let everybody get situated, and we'll get started momentarily. Hello, everyone, and welcome to the 2023 August Advocacy Action Month. Thank you for joining us today to learn about how you can advocate for an increase in appropriations for ALS research. You may have heard that some members of the House of Representatives are proposing serious cuts to research as well as to healthcare programs. Your advocacy can make a real difference in convincing both representatives and senators that they must increase, not cut, research for ALS across the federal government. Today's webinar will prepare you as a constituent to take action and to convince your members of Congress of the importance of increasing, not cutting, ALS research. If we could advance to the next slide. Before we get started with today's program, I want to take a moment to thank our sponsors who have made August Advocacy Action Month possible with their generous support. Our gold level sponsors are Amylyx, Biogen, Cytokinetics, and PTC Therapeutics. Next slide, please. And our silver level sponsors, Apellis, Genentech, Neurosense Therapeutics, Mitsubishi Tanabe Pharma America, and Sanofi. I would now like to turn this over to Colony Balas, the president and CEO of the ALS Association, for some opening remarks. Colony, you have the floor.
Thanks, Jeremy. And I too want to welcome everyone. My name is Colony Balas, and I have the real honor and pleasure of being the president and CEO of the ALS Association. And I just want to thank you for joining us on this new kickoff of our Advocacy Action Month happening in August. It's all A's all the time. And what's amazing to me that today we have over 900 people that have registered to be part of this event. So you might be sitting in your living room or in your kitchen or on your desk, and you might think you're alone, but you're actually with over 900 of your best friends who are here to do the same thing as you are, which is really helping to urgently advocate for treatments and cures. And you know this, while we are searching to make ALS livable for everyone, everywhere. So this webinar is going to be recorded and be posted. If you have some friends who weren't able to be a part of this live while it's happening, we are going to record it and we're going to post it. So Jeremy just mentioned that some of our members of Congress have proposed some really drastic cuts this year to health programs, which is pretty alarming all across our country and really all across disease areas that we're all very concerned about. The Senate isn't necessarily proposing drastic cuts, but they're also not proposing increases in ALS research either. And so that's really where you come in. We really want you to think about helping you, us, everyone, everywhere, to really implore on Congress that they need to increase funding to research. I think over the last year, we've all really learned how important, we know this, but it really sat in our hearts how important research is to getting new treatments, new therapies across the line and making ALS livable for everyone, everywhere. So thank you for being a part of that. Your advocacy, and I say this every year because it's actually true. Many of us are in the Washington area. Most of us didn't grow up in this area. And what I know to be true is that members of Congress care about the people that live in their district and what you think. You might have Jeremy or Dustin or Daniel or Kathleen, or Melanie, our entire advocacy team come forward with really smart ideas, but they want to hear from you. They want to understand your story. They want to understand why this is important, and they want to understand why you care about research and how you're going to vote because of what they do. So soon you're going to be hearing from Dr. Kuldip Dave, who is our Senior Vice President for Research, about all of the work that the association is doing and why our ALS federal research programs have to be increased so that we can really boost our efforts towards treatment and cure. And you're going to hear some really fantastic other speakers, ALS researchers, a physician, people living with ALS, and a couple members of Congress. So during this webinar, we're going to share with you 8 easy ways. I love this. I always love it when I can kind of put it into punctuated bullet points. 8 easy ways that you can get involved to really help make a change for people living with ALS, their families, and their caregivers. And everyone can get involved in this really important effort. I also want to really encourage you to ask family members and friends, businesses in your community to take action. This is actually something they can do too, and they can join you in the fight. So thank you for all of your efforts in increasing research and funding. Each one of you are really important to making a difference. So with that, Jeremy, I think we should get on with it and talk about those 8 easy ways, listen to Culdip and all the great people that are about to join us. And just really quick before I hand you the mic, I also want to thank our staff. There are a lot of people working behind the scenes to make this happen. This seems so easy when we just broadcast something across the country, when there's nearly 1,000 people that are joining us. It's not easy. So thank you all for all the hard work that you do, not just today, but 365 days a year. Jeremy, I'll turn the floor over to you.
Thanks for that, Colony. Thanks for that really great message. Before I move things along, Dustin mentioned in the chat, but we will have a Q&A session during the programming. So if you do have questions that emerge either now or at any time during the next hour we have together, go ahead and use that Q&A box down at the bottom of your screen, and we will do our best to answer questions live and in person. If we don't get to your question, we will follow up in email form with an answer to that question. So use the Q&A function throughout the session. But in the meantime, we are going to now hear a very powerful message from one of our advocates, Katie Adams.
Hello, my name is Katie Adams, and I'm from Henderson, Kentucky. I was diagnosed with ALS on October 28, 2022, just a few days after my 39th birthday. I have 2 daughters who are 9 and 14 years old. I have a very loving and supporting family and many close loved ones. After my diagnosis, I knew that I wanted to help. I just didn't know how I was going to be able to help. But shortly after my diagnosis, I figured out the hard way that because of a law in Kentucky and most other states, I only had one option when it came to supplementing my Medicare, and that was a Medicare Advantage plan through United Healthcare. Just 2 months of having this policy, they denied my first pre-authorization, which was my power wheelchair. Being an occupational therapist my entire adult life, I knew the ins and outs of Medicare Advantage plans and the pre-authorization process. However, I was still shocked and honestly appalled that they had the nerve to deny someone with ALS such an important piece of medically necessary equipment. It was then that I told someone from the Kentucky ALS chapter about my difficulties, and she got me in touch with a colleague from the ALS Association that happened to be working on this specific bill in Kentucky. And so they asked if I would be willing to help. And of course, I said yes. I actually said 1,000% yes. And just like that, I was advocating, not only for me, but for everyone else who has ALS and anyone who may have ALS in the future, and to show my girls that it is important to stand up for what you deserve and to fight for things worth fighting for. I'm sure there are many of you who felt just like me when you were diagnosed. You knew you wanted to help, but you didn't know how or what that would look like. My advice to you is just do it. Reach out to someone in your local ALS chapter and let them know that you will be willing to advocate however they may need it. People living with ALS and our caregivers are the experts in this disease. We live this disease day in and day out, and therefore no one else knows better than we do. And to advocate, that is all you need to do, is to just tell your story. Lawmakers, policymakers, politicians, and even your own community don't know what it is like to have ALS. We need to be the voice and spread awareness of this terrible disease so that we can help everyone understand how devastating it is. We need to be the squeaky wheel that gets the grease. The ALS community desperately needs more resources thrown at this to be able to continue to make progress towards treatment and a cure, and just to make this disease livable. In order to do that, we have to tell people our stories. Our stories are so powerful just by the nature of the disease. But honestly, anyone that I've ever met who has ALS is one of the strongest and kindest and caring people that I've ever met. Even having this awful disease, I am able to feel validated in my concerns by advocating. I am able to show my daughters that you have to fight for what you deserve and that you can make a difference. I have gained so much fulfillment in my life by advocating for change for people who may have this dreadful disease in the future. If I can do it, so can you.
Katie's truly amazing and inspiring. So thank you, Katie, for sharing that message with participants. I turn things over now to another ALS advocate, Steve Kowalski.
Thanks, Jeremy, and hello, everyone. My name is Steve, and I was diagnosed with ALS in 2017. I live in Boston, Massachusetts, and I consider myself an ALS advocate with 5 years of experience meeting with the Massachusetts congressional delegation a few times a year to keep ALS on their radar and remind them the importance of funding ALS research and care on an ongoing basis. I've attended in-person meetings on Capitol Hill, virtual meetings during the pandemic, and this year we are trying something new, in-district meetings this month. The format may have changed, but our messaging has remained steadfast and consistent. Living with ALS has been challenging. So much of the challenge has been what ALS has done and continues to do to me and my family. I find advocacy allows me to take direct aim at ALS and do something proactive to combat this difficult and challenging disease. Like it's been said recently, this is the year where we see some possible funding challenges ahead. We all know Congress remains divided on spending versus spending cuts. In my opinion, this year it is more important than ever not to back down, but to step up to remind this Congress we expect ALS research funding to increase and remain a priority. Since my diagnosis, great progress has been made, largely because of people like you who advocate for what we need to make ALS livable until we find a cure. Adequate research funding is more important than ever to ensure the momentum we have continues, and in addition, and it allows for us to extend our life. For many of us with ALS, the clock keeps ticking. We don't have time to wait. Whether you are meeting in person or reaching out to members of Congress in other ways, tell your story, explain in detail your challenges, ask for their support, and most importantly, follow up and hold them accountable. I'm proud to be part of this effort. I know when we come together, we do great things. I want to thank the ALS Association for coordinating and empowering us to collectively make a difference. Thank you, and back to you, Jeremy.
Thanks for that message, Steve, and thanks for all that you do for the community and all that you do in the advocacy front. I'm going to turn things over now. We're going to hear from Dr. Namita Goyal, Director of UC Irvine MDA ALS and Neuromuscular Center.
Hey everyone, my name is Dr. Namita Goyal and I'm a neurologist and director of the ALS clinic. at University of California, Irvine. I've also been working in clinical trials in ALS for over 15 years. I'm so happy to be here today to talk to you about how funding helps advance ALS research. It's because of funding such as this that we've now been able to get 2 drugs FDA approved just in the past year, making it a grand total of 4 medications that we now have to fight ALS. Big congratulations to the field. But we still have more work to be done, as we still need more effective therapies to robustly stop the progression or even reverse symptoms of ALS. In essence, let's find a cure for ALS. Currently, we have so many researchers, patients, physicians, and scientists all working together in this race to find a cure, and this race has never been hotter, with so many clinical trials in the pipeline. Funding for ALS research can help the field in many ways. 1, it can help drug development. 2, it can help build infrastructure so that the teams and centers that conduct these clinical trials can build a team to run clinical trials efficiently and safely. 3, it can help with biomarker discovery. We need better biomarkers to diagnose ALS earlier and even monitor if a drug can have an impact on the disease earlier than we can detect currently with the current outcome measures. And 4, we need funding to help support expanded access programs. This allows patients with advanced ALS or with longer disease duration to get access to cutting-edge therapies when they wouldn't meet the strict criteria that would allow them to enroll in a clinical trial. I'm thrilled to see the efforts for ALS funding, and I'm confident that this can take ALS research to the next level, which means getting more treatments and in turn better care for our patients with ALS. Thank you.
And as you can see, coming up next, we're going to hear from Dr. Kuldeep Dave, Senior Vice President of Research for the ALS Association. Dr. Dave, you have the floor.
Hi, thanks, Jeremy, for having me. And thank you, everybody, for joining today. Next slide, please. So I'm going to talk to you about why government funding is so important for ALS research. But before I do that, let me introduce the ALS Association's research program. We are the largest philanthropic funder of ALS research in the world. And our funding process is on the left here. First, we identify where there is a need for our research dollars. And we work with our community. We attend conferences. We identify gaps and opportunities where both us and government funding can help to move research forward. Once we identify that area of need, we then request and review applications. And so we put out a request for applications called RFA, and we ask scientists or researchers to apply into the association with their ideas. And so these are targeted requests for applications, and we have a rigorous 3-step process by which projects get selected. And this 3-step process, which is rigorous, transparent, allows us to fund the best projects around the world. And just for your information, we fund academia, we fund pharmaceutical and biotech industry. We also provide funding for government labs and even other nonprofit organizations who we fund or co-fund to launch programs. Next. And so what happened in 2022 last year? We issued 7 requests for applications or RFAs. And these were topics across the ALS research ecosystem, which I'm going to talk about in the next slide, what that ecosystem looks like. And just so you know, we reviewed approximately 250 applications from all over the world, from 18 different countries, Washington, D.C., Puerto Rico, 29 different states. And happy to report that last year we committed $15 million to fund 59 brand new projects. So about a 25% funding out of the 245 applications that we received. So I talked about the ecosystem. So next slide shows you what the research ecosystem is. And if you take anything away from today's, my presentation from today, I want you to remember this ecosystem because I will show you where the government funding comes in and where our funding comes in. So I'll start from the very left here, which is biology and genetics of ALS. This is really important. This is where you do research to understand what goes wrong in ALS. What are the proteins? What are the genes? What are the pathways that go dysfunctional and that somebody gets ALS, sort of the underlying biology. And underneath that, you see risks and causes of ALS. So this could be genetic risk, but it could be environmental causes. What are the environmental factors that may increase your risk of getting ALS? Once you have a biological understanding on that left side of what goes wrong, then you move to the next thing here, which is called preclinical drug development. And so now you start making drugs against that target or against that molecule. And this generally happens in industry, but also in academia. And this is preclinical, means it's before the clinic. It happens on the lab bench. It may be in animal models. It may be in test tubes. But this is where you test whether a drug is safe and is if efficacious or works or has efficacy in a model system. And only when a drug is safe that you take it into these next three phases, phase 1, phase 2, phase 3 of clinical testing. And this is where you test the drugs in humans. So phase 1 is much smaller, generally 30 to 50 patients. You test for safety, make sure the drug is safe. Phase 2, now you start to bring in a little larger population, about 100 to 150, 200 people with ALS now, and where you test for both safety and perhaps efficacy and see if there's a signal. And then a phase 3 where you now do a larger trial, generally more than 200 people with ALS. And again, you test for safety, but now efficacy in a larger population. And only when a drug goes through these three phases does it get to be drug approval, which is what Dr. Goyal talked about. We are lucky to have 4 drugs approved by the FDA for ALS. What we always forget is this side on the right. In the real world, there are people living with ALS, and there's a lot of research that can help them to manage the disease. And that's research into assistive technology, telehealth, telemedicine research, quality of life research, patient surveys, burden, both on patient and family and caregiver burden, natural history studies, and expanded access that Dr. Goyal mentioned. And then underneath that all is this, it's never the most sexiest piece of anything, but infrastructure, which is really important because this infrastructure around specimen collection, databases, tool development, training of new staff underlies this entire ecosystem. So next slide, you may wonder what the ALS Association funds. Well, last year we funded across this ecosystem. And this is where I told you we committed $15 million to 59 projects across this ecosystem. And can you hit next? And as of today, we have 132 or so projects that are active across 13 countries. And if you added up the number of dollars committed to those 132 projects, it comes out to about $40 million. So now, I talked to you so far about ALS Association funding. In the next 5 minutes, I'll talk to you about government funding and how does the government funding overlay this ecosystem? Where do all the different agencies actually fit in and where are they funding and what is their specialty in funding? So go to next slide, please. And so this is the current congressional funding for ALS research. And what you're seeing here, these are all names that I will spell out. NIH is National Institutes of Health. This is the single largest funder of research in America, but frankly, and also the single largest funder of ALS research. We are the largest philanthropic funder, but you could see that NIH funds 10 times more than we're funding. And so $131 million has been is projected funding for ALS this year. The CDC, or Centers for Disease Control, everybody knows about CDC given the whole COVID situation, has a program where they fund $10 million of ALS research. And I'm going to go into details for each one of these, but I just want to quickly give you a summary slide on where we are. The DoD stands for Department of Defense, and this is the ALS research program, or ALSRP, and they fund about $40 million is what's projected for this year. The FDA, the Food and Drug Administration, the one that provides drug approval, is providing $5 million to ALS. And then, of course, what Dr. Goyal mentioned, expanded access through the Act for ALS funding last year. We are projecting to get $75 million being spent for expanded access. So now I'm going to go through each one of these one by one so that you understand where they fit into this ecosystem. Next slide. So here's the NIH. So NIH sort of takes the same strategy as us. They fund across this ecosystem through their various agencies. And again, NIH stands for National Institutes of Health, but they have other agencies. They have NINDS, they have NIEHS, they have NIDA. These are all different national agencies that fall under NIH that provide funding for ALS. And as I said, they provide a total of $206 million that's projected funding. And if you hit next, that's including both research spending, $131 million, and expanded access, which is $75 million from the Act for ALS law that was passed last year by President Biden. And so if you are wondering, okay, so they're funding in this entire ecosystem, where is most of their funding going to? And if you hit next, what you realize is that the funding is, thank you, and the funding is going to two really distinct parts. The one on the right here is expanded access, which is, as Dr. Goyal mentioned, providing access to people with ALS who may not qualify for clinical trials, but would like to get access to experimental therapies. And this is $75 million to expanded access. But really what's even more important and significant is that, as you can see here from this chart, and you don't have to walk, I'm not going to walk you through this, but what you really need to see is the 62%. 62% of the 131 million is going towards biology and genetics of ALS. And this is really important. Remember, I told you, this is the first sort of foundation on what we build drug development on. And so it's really important, this piece, that the government is spending 60% of $131 million on that biology piece. So that's NIH funding. Let's go to the next agency. Next. And this is the CDC. As I told you, the Centers for Disease Control has a $10 million program, and their funding mainly goes to the National ALS Registry. And this $10 million, if you hit next, is not just going to the ALS registry, but the ALS registry collects data on what kind of risk factors you may be exposed to. For example, did you live in a certain area? Did you live near a lake? Did you serve in the military? Did you, work in a plant? And these are, CDC is really this funding from the National ALS Registry is really the only government agency that solely focuses on prevention. If it can identify risks that increase your risk of getting ALS, that we could potentially prevent people from getting ALS, because then you can prevent some of those risks or reduce risk, or as we call risk reduction. So this is a really important program. Next slide. So the third, so we talked about NIH, we talked about CDC. The third program was DoD, or Department of Defense. And if you hit next, the Department of Defense is actually funding a very different part of ecosystem. You can start to see now where these agencies are funding. The Department of Defense is actually funding this second phase, the preclinical drug development, biomarkers development, and early stage clinical trials. And this funding really came from the fact that, there's studies now showing that veterans are 2 times more likely to get ALS. And so the Department of Defense has provided funding for ALS almost 20 years ago, which has now risen to $40 million. So again, a large program, but their focus is mainly on this high-risk translation piece of translating biology targets into clinic. And so this is where they come in, providing funding for preclinical drug development and early stage phase 1 trials. Much more expensive, and that's why you see the number to be so large. And then next slide. And then the last one was the FDA hit next. And the FDA funded about $5 million projected to this part of the ecosystem, where they provided funding through Act for ALS for improving clinical trials. We want to make clinical trials, that we want to have more trials, we want to have better and faster trials. And FDA, similar to our strategy, has focused on that more, better, faster trials. And so that's where the FDA funding goes. And so I would like to end here. Next slide, please. So you can see here, and there are all these bubbles on top of this ecosystem, and I'm not even showing our ALS Association funding here. This is just a government funding. They are funding across this ecosystem, but they're not funding in the same way. Each agency is unique. They're funding different aspects. As I told you, NIH funds biology and genetics. 60% of their funding goes into biology and genetics of ALS. The CDC is funding risk and causes. The DoD is funding the next stage. And we want this. We want each of the government agency to be funding these specific areas, because we want the biology and then the drug development piece to keep moving to the right towards drug approval. And so each agency is unique. And yes, we fill in the gaps when where the government piece may not be filling the gap, and we can lead the way to those new opportunities. But that collaboration is important, but coordination is even more important. We must all work together to advance this ecosystem as a whole. And so I'll stop here, and thank you for allowing me the opportunity to speak to you today. Thank you.
Thank you for that, Dr. Dave. Very informative. I never want to turn now to the Q&A portion of the event. You mentioned environmental risk factors. What is the state? Somebody wants to know. I'd love to understand the process to even begin looking at environmental causes.
Yeah, so the CDC is doing a really good job at this. The National ALS Registry, by the way, let me back up a little bit. The National ALS Registry is a volunteer signing up. Basically, you go to this website and you sign up and say, I have ALS. And then once you declare that you have ALS, then they send you question and answers on, where you've been, where were you born, what did you eat, what did you, what was your job? This is one way to find out environmental causes, Jeremy, which is to look in the past and see, what is a risk factor that we can link ALS with. Think about smoking and lung cancer. We now know that lung cancer, that smoking is the single biggest risk factor for lung cancer. But you would have to question people first whether they were smoking and see if there is a link to lung cancer. And that's exactly how you understand environmental causes. You look for linkage to where people may have lived or worked or born, or something they may have eaten or been exposed to, or served in the military, to then link it back to ALS. What's great about CDC's program, Jeremy, is that they are funding identification of those risk factors. And then, as I speak about coordination, the ALS Association has a new prevention program where we're saying, okay, now that you have identified risk factors from the CDC funding, now we will help you translate that into prevention approaches.
Question about research or funding for training doctors, training nurses, training hospitals. What resources are available for that education?
Yeah, so this is a really, really important question. what we've seen in the ALS space, and I think it's generally across the board, is that there is a high turnover in our clinic staff. That whether it's physicians, whether it's physicians assistants, whether it's nurses, trial coordinators, clinical care coordinators, there is a huge turnover rate. And some of these clinics have trouble sustaining staff, and if you have to hire new people, that slows down whether it's care, whether it's research. And so, Jeremy, we, the association, last year launched a brand new program on trial capacity that does exactly that. It funds staffing and infrastructure and capacity building at clinical sites, so that those clinics can both sustain their staff, but train new staff, and also be able to hire, get new equipment, get new freezers, get new training, and be able to coordinate trials faster and care faster.
Dr. Dari, do we know why veterans are more likely to develop ALS? And there's a question about whether that data point extends to people in the military outside of the U.S. Do we have any data on that? Do we know?
Yeah, good question. So question number one is, actually, let me answer the second one first. Yes, now there are multiple studies. There was a really nice study from Israel, I think 2 years ago, showing a very similar thing. In fact, they were showing in that study higher than twofold risk for veterans that ended up getting ALS. I think it was something like 4 or 5-fold. So yes, there is. It's not just U.S. military veterans. It seems to be outside. It seems to be outside the United States as well. To answer the first question on, do we know why veterans are 2-fold or 4-fold more likely to get ALS? We don't know or understand that well. There are a lot of ideas or hypotheses. Is it PTSD? Is it fire pits? Is it, burn pits? Is it being in the field and, being in the ground and smelling toxins? Or is it, gun and ammunition? It could be a lot of those things. It could be a combination of those things. We just don't know. This is one of the reasons, as you'll hear later from Denise, we're asking for additional funding for CDC beyond the $10 million, the additional $5 million for looking at research into veteran risk research, which is what of those risk factors may be driving that increased risk of ALS. This increased funding and the reason why we're asking that funding to go to the CDC is because CDC is already involved in a prevention funding program. And so they could then leverage that program to study for what it is that's driving the risk for veterans.
Well, Dr. Dave, thank you so much for sticking around and answering some of these questions. A lot of great questions in the Q&A that we have not gotten to, but as I said at the top, we will answer those individually via email. So please continue to send your questions in. We will get them answered to you, but unfortunately, in the interest of time, we are going to have to move things along. So with that, I am going to bring in Denise Balin, the Director of Congressional Affairs for the ALS Association. Denise, the floor is all yours.
Hello there. Well, I want to introduce some very key people on Capitol Hill who are working hard for the ALS community. So you're going to hear from some amazing ALS champions on Capitol Hill. Some of them are on appropriations committee who are handling funding for ALS research. Some sit on key committees, but all of them, I can say, have one thing in common. They really are trying to improve the lives of people living with ALS and their families. They're all doing something to help us move forward in making ALS a livable disease and making lives right now improve with the care that you can get at home and with your doctors. So I just want to kick it off so we can play these great videos.
Well, hello to everyone, and thank you to the ALS Association for hosting all of this, but really thanks to all those of you who've joined across the country as advocates. We know that ALS is a cruel disease, and so many of us have been impacted personally and have family and loved ones who have battled ALS. Personal experience with ALS is what inspired me and those in my family to get involved with advocacy. And since then, I've been very proud to work with you on championing causes for the ALS community here in Congress. I'm an original member of the Senate ALS caucus, and a proud one at that. We work together to bring senators from both sides of the aisle to work collaboratively on behalf of those living with ALS and their families. I'm also very proud that the Act for ALS legislation, this was a legislation that I teamed up with my colleague, Senator Coons. That has been signed into law now, last Congress, so that's on its way. But this legislation passed with strong bipartisan support, but it was really thanks to the efforts of advocates like you. I'm continuing work here in Congress to secure funding for Act for ALS and for other federal research activities that support ALS research. We know that ALS is unforgiving, but know that your advocacy really does make the difference. It's your stories and your voices that can impact millions with your support. And so know that you make a meaningful difference in the lives of those with ALS and spur all those to find a cure. So good luck to you in your continued efforts. Know that I'm right there with you at your side. Take care. Be well.
Hi, this is Senator Whitehouse coming to you from the Hope Artiste Village in Pawtucket to thank all of the ALS advocates for their amazing work. I'm delighted to help make May ALS Awareness Month again. We're continuing to work to make sure that the ALS disability law that allows early collection of benefits for people diagnosed with ALS is enforced widely and that we can take full advantage of it. So to all the advocates, thank you. The families that have to deal with an ALS diagnosis, it is a very, very hard thing, and we want to make sure that we have your back as you go through all of this. So to the ALS disability advocacy community, God bless you and thank you very, very much.
Hey everybody, it's Congressman Seth Moulton from Massachusetts. One of the towns that I'm proud to represent is the city, actually, of Beverly, Massachusetts, which is the hometown of Pete Frates. Pete was one of the more famous ALS patients of the past couple decades because he started the Ice Bucket Challenge. He got me to do it. He got thousands of people across America to do it, bringing attention to this devastating disease and also raising thousands of dollars, literally hundreds of thousands of dollars to advance ALS research. Getting to know Pete and his family personally, because I work for them as their representative, taught me so much about the impact of this disease on the individual, the family. I mean, Pete had not only brothers, mom and dad, but kids. And to watch his family so bravely go through this, to watch Pete so bravely go through this was inspiring to me and my work on so many levels. But of course, it also brought home the urgency that we have to approach this problem. We've got to accelerate ALS research, and I'm doing what I can in Congress to do that. I know as a Marine veteran that ALS disproportionately affects veterans, and that's why we try to get ALS research dollars in the defense bill every single year. But there's so much more we can do as a community and as a country, so thank you for all you're doing to bring attention to this disease, to work on getting us towards a cure, and to take care of everyone who's affected by it. Thanks, I stand with you. Keep in touch.
Hi, I'm Senator Chris Coons from Delaware. Thank you to the ALS Association for inviting me to speak to the resilient, brave, and strong ALS community from across our nation. Thank you for all that you're doing to increase awareness, to advocate, and to fight for greater funding for ALS research. As co-chair of the Senate ALS caucus, as a member of the Senate committee responsible for funding research into diseases like ALS, I promise we won't let up in our efforts to fund the research that develops better treatments, and eventually a cure for this dreaded disease. Over the last few years, thanks to your hard work, we've seen real progress. We now have a more comprehensive ALS research agenda, and research has advanced to the point where we can now identify clinically useful biomarkers to isolate specific genes linked to this disease. In Congress, we passed bills like the Act for ALS bill, which I introduced, co-sponsored, that are funding essential research, expanding access to promising treatments, and authorizing $100 million annually to carry out these priorities. Our path forward is promising, but we need you. With your advocacy, as long as funding from Congress continues, we can make ALS a survivable disease within a decade. As an appropriator, I'll keep pushing funding to the highest levels to advance research and treatment and find a cure for ALS. Your voices drive the funding levels. My colleagues and I listen to what you have to say. So keep speaking up, keep pushing us until we are able to fully fund ALS research. Keep doing the good, hard work we need to defeat this terrible disease. I'm inspired by the grace and the courage of those suffering with ALS and their families. I'm grateful for your engagement and advocacy that brings attention every day to those suffering from this disease. Your engagement today and every day is invaluable. It builds hope. I look forward to working with all of you and keeping up the fight until we end ALS. Thank you.
Denise, am I turning this over to you?
Sounds good.
All right.
Well, I think what everyone just saw is that every one of those senators and the member of Congress that provided us video really recognized the impact that you as ALS advocates have on your elected officials. You really provide the understanding of the disease that more than they can understand if they lived it personally. So you really make the impact. So if we move forward, we're going to talk about, why we need you. I think Caldet provided a really good overview on all the funding for ALS research that's going on. Right now, there's about $250 million that the agencies combined are spending on ALS research, but that's not enough. We need to move the dial further along, and we need you to urge your lawmakers to make those increases. So specifically at the Department of Defense, we want to double the amount of money that they're spending on research. There's really some promising programs out there that the Department of Defense can support so that they can find out why and how to stop military personnel and veterans from developing ALS. So that's why the Department of Defense can really take a look at this program. The NIH, as Caldet shared, has multiple programs to support people living with ALS. Not only are they doing research for ALS, but they're also implementing the Act for ALS by providing experimental therapies right now for people living with ALS. At the same time, the FDA is doing their research on developing how to develop drugs faster. What mechanisms do they need? What support? What new technologies? But this Act for ALS and the funding we get for Act for ALS will really help us get us there quicker. And the CDC, we want to increase the CDC budget so that we can really understand the risk factors for those in the military. So we're asking for a lot. We're asking for $80 million at the DoD, at least $150 million at NIH, just for ALS research. To fully fund the Act for ALS, then $100 million, and to increase the CDC budget. So with your help, we can get this done. Congress has left DC. They're no longer here in the DC area. They are working in their state and in their district, coming to see their constituents, coming to see you. Now is your time to engage with them. and talk to them about why it's really important that they increase this funding. They haven't finished their funding work here in DC. They have to decide that and finalize that in December. So right now is the time to remind them one more time, why it's important for them to increase ALS research. So I really appreciate every single one of you spending your precious time to help ALS, a livable disease, as we increase funding for ALS. And we can move along to the next section.
Up next, we're going to hear from Dustin Purcell, Director of Advocacy, Engagement, and Mobilization at the ALS Association. Dustin, take it away.
Awesome. Thanks, Jeremy. And thank you so much to everyone for joining this afternoon. You've heard from a lot of great folks, experts, ALS advocates, members of Congress, and now it's time to take action. So next slide, please. All right. So earlier in July, we have held some different meetings. We held an in-district meeting training. We held Advocacy 101 training and Advocacy 201 training. Both the 101 and 201 trainings are currently available on our website. And if you are an advocate that's part of one of our 42 key appropriations lawmaker meetings, reach out to your ALS staff partner if you need the recording of that. We also have some additional materials, as well as an in-district meeting toolkit that we've sent out. So we're getting everyone all ready to take action this month in August. Next slide, please. So as was mentioned at the top by Colleen, there are 8 ways to take action. And you actually right now are able to access all of them by going to als.org/August. You can also scan the QR code on your screen right now to get taken to that site. But all 8 of these actions are live and ready for you right now. And I'm going to walk through some of them as we go forward. So next slide. So first, become an ALS advocate. Many of you on the call are, and you receive our emails and you take action, which is fantastic. But maybe you know friends and family who want to join with us. Well, they can go to als.org/advocate, as you can see there, or scan the QR code if you're watching the recording here, and you can sign up. One little pro tip, when you use our form, type in your address in the address bar and then select the dropdown for that. That's the one thing on there with that. But you can also then select to provide your cell phone and sign up for text messaging through when you sign up there as well. And then you will also let us know your connection to ALS. So encourage everyone to sign up and join if you haven't already. Next slide, please. So maybe you are already an advocate, your emails, but you're like, what is this text alert thing you're telling me about? Well, you can text ALS to 855-469-2621. And I promise we won't spam you, and we will only send you the most urgent updates to our text alert program. So if you haven't already, you can pull out your phone and you can text ALS to that number there, 855-469-2621. And next slide, please. And I know I'm going kind of quickly with some of this, but know this is recorded and you will have access to all this information going forward. So for Action Month, we have this current schedule to kind of highlight the action alerts. As I said, you have access to all of them now. To kind of focus our efforts, we're going to spend and focus on one each week. So you might have already seen that there was an email that was sent out earlier today that was on our Letter to the Editor campaign, where you get to write your letter to the editor and submit it. And then you can see for the next following weeks, we have our call district offices. There's an office drop by alert, and you can actually write a letter, and then we're going to end with sharing stories. And again, you see them all here. So we're going to make sure that you are kept up to date, and then we're focusing our advocacy efforts going forward, so everyone has an opportunity everywhere to take action on all of these 8 different ways. Next slide, please. So this is our Write the Letter letter to the editor alert. That's a mouthful. But you can see here, you just enter your basic information, including your zip code, and then it will populate as the second image here with the newspapers that are closest to you. And then you can then edit the headline, and you can also fully edit the letter to the editor that we pre-populated for you. The bottom right-hand corner extends down so you can then see it all there, but then you simply hit send your letter to the editor and it will send it off for you. So it's a pretty easy template. And I can tell you before this call, we had over 60 advocates who've already taken action on this. So join with them, scan the QR code, and hopefully check your email inboxes as well. And you'll be able to take action on this as well. So next slide, please. This is actually just the letter to the editor in full format. So you can see it there. There is a 300-word limit, but you can go in there and copy and paste it, put it into a Word doc or a different doc, and then add in, customize it. I highly recommend you customize it. That makes it that much better. So, but just be aware of that specific word limit. Next slide, please. Okay, so call your district offices. Calling district offices is incredibly important and it's incredibly powerful. District offices keep track of calls that come in, and we've made it really easy for you. We have a script over here on the side that will pre-populate with your member of Congress. And as long as we have your number, then you're able, the system, when you click that blue button, will call you directly, almost immediately to your phone. And there's instructions on the side if you need to update that. And then we're also very sensitive to the fact that in the ALS community, not everyone is able to place a phone call, but we want to band together as one community and represent those who don't necessarily have a voice and provide that voice for them by flooding the offices with phone calls, asking for increased funding for ALS research. So this is very important. It's very powerful. And it only takes a minute or two when you call these offices. They're very friendly, and you might even be able to leave a voicemail. So when this comes out, I highly encourage you to take action on this and take that next step to call a district office. Next slide. All right, and so another step up beyond even making a call is visiting a district office. So as Denise mentioned, folks are back home in August, and district offices are busy with different activity. So we have an alert here where you can actually download our ALS research funding one-pager, and you're able to print it off and then go to your local office, and then you can report back and let us know that you have delivered that information to that office, and then let us know who you met with or any conversations that you might have. We've provided links in case you were like, who are my lawmakers? We have links to find your lawmakers. We have links to locate the district offices, as well as the link to download that one pager. Now, some of you may even have existing contacts with these offices. You could instead email it to these contacts as well, and then log that interaction and let us know that you have emailed and reached out to that specific office to deliver that one pager. And you're going, Dustin, well, what does that one pager look like? Well, next slide. Here is our new ALS research funding one pager, which outlines our asks that you've heard from Denise and others, and as well as kind of explaining what ALS is and explaining a little bit about the ALS Association. And then we also have our email address at the very bottom in case you or members of Congress have questions as well. So this is the document that you'll be able to print and send off. Next slide. And this is just a simple, many of you have seen this action alert before, where you are able to select your member of Congress and senators, and you are able to edit the subject line, and in the white box in the middle, fill in your story as well. So I highly encourage folks to take action here and to flood inboxes with requests as well, because they do track that. But this is a fairly simple ask that we'll also have folks take action on. Next slide. Now, I know there's been, Twitter, X, whatever they may be calling it, every member of Congress is on the platform. And so we have this easy alert available for you to tweet your members of Congress to ask them to increase and not cut ALS research funding. And it links to that one pager, which you saw earlier. So if you have a Twitter account, then you can send that off. If you don't, you're actually able to copy and paste these in and use whatever social media account you have and just adjust them and tag it appropriately for the members of Congress if they're on that specific platform. Again, a really easy but impactful way that communications directors and others track what goes on. So it allows us to communicate with folks in that platform. Next slide. And so this is where our Share the Story, we have our Share a Story page. And so they will fill in your information. That's what you see on the left-hand side, and you'll keep scrolling down, and there are step-by-step instructions where you can actually record a video directly on the website. You can upload a video from your phone or computer. You can upload an image or a Word doc, or you can type your story right into that and hit submit. And so if you go to the next slide, I actually shows you how we're actually displaying these. So whether it's a written story, you're sharing your image, or you're recording a video for us, we want to make sure we have stories from all 50 states, from all over the country, to be able to share with lawmakers. Right now, I think we have close to 48. And so if you haven't, go ahead and check those out. But we want to add your story to this as well. So next slide. So as I mentioned, we do have key member meetings that are happening. And so I know we had some questions about where are those folks? Well, these are the folks who are on the appropriations committees who are deciding a lot of the stuff. So we are doing in-person meetings with these folks. There are 27 targets, as you can see here in the House, and they're marked on the map. So if your member is there, they're very important to this process. Next slide. And these are the folks in the Senate. We have 15 targets there, so you can see where those folks are currently located across the map as well. Next slide. For these specific meetings, we have stickers and fans, which we'll be holding out, kind of amplifying that folks are ALS advocates, so they want us to fund ALS research. You can reach out to staff partners to get these materials. Your managing directors of advocacy, other folks who are going to be helping with these in-person meetings will be able to get you these resources. Next slide. Also, I know that I've given a lot of information, and so we want to make sure that we answer any and all questions as they come. So this is the email box where you can reach me, and the advocacy team here in DC is advocacy@als.org. Please, please, please stay in touch. If you have any questions at all or want more information, please reach out to us there. Next slide. All right, Jeremy, I'll turn it back over to you.
Thanks for that, Dustin. It's now time for me to, with great honor, to turn things over to Scott Koff, Chair of the ALS Association Board of Trustees.
Thanks, Jeremy. And good afternoon or evening or morning, as the case may be, since there are so many on the call. Yes, I am the chair of the Board of Trustees, but I consider myself first and foremost a caregiver to my son, who was diagnosed a little over 12 years ago. So living proof of what it means to make ALS a livable disease. You heard others speak, and we often talk about the diagnosis date, June 6, 2012 in our case. 3 years later, I wheeled him into place as he watched his bride walk down the aisle. 3 years after that, they made me a grandfather, and I am now with a 5-year-old grandson, a son, and a daughter-in-law who live 5 doors down from me here in Palo Alto, California. And if ever there was evidence of it being a livable disease, he and his miracle worker wife just got back from a trip to Las Vegas. So she got him in the van with 2 caregivers. It's about an 8-hour drive from here. And when he got back, just using his eyes to blink different letters, because that's his communication process at this point, he managed to let us all know that at age 38 and a half, he would like to celebrate his 40th birthday back in Las Vegas. So just to put a fine point on just how important advocacy is, it is one of the 3 core mission pillars of the ALS Association. In addition to research and care services, advocacy is one of the pegs we hang our hat on, and we do it more effectively than any other organization in our space. And traditionally, we've used the month of July to, quote, take the hill. And I love this new approach of being in district now, where you get to meet with your Congress people in a more relaxed environment. You get to meet the local staffs in addition to, who we might bump into in DC. And I think they're more receptive. At least that's been my experience in hearing your personal stories. Now, I have the good fortune of living in California's 16th congressional district, and my congresswoman is Anna Eshoo, who is the ranking member of the Health Subcommittee within Energy and Commerce, and she was a key architect of the landmark Act for ALS bill that was signed by President Biden in December of 2021. And I know that making contact with her on a regular basis, having her see my family, is a core element of what creates the drive that you heard from our congresspeople. And hopefully with your work, we'll continue to expand that sense of empathy and understanding. When I hear what these congresspeople said today, and I think what they might have said 10 years ago, the level of awareness now, the compassion, and the purpose that is driving a lot of these discussions leaves me optimistic, even in the face of an environment where we keep hearing that there are others that are looking to cut funding. So I want to add another couple of A's to the A's that Colony talked about. I think August is a great time for advocacy. I think that it is the anniversary of the Ice Bucket Challenge. And about a year after the challenge, it had won the equivalent of an Internet Academy Award. It was called the Addies. And one of our co-founders accepted the award on behalf of the ALS community. And at the Addies, you have to limit your acceptance speech to 5 words. And this is Pat Quinn, and his 5 words were, every August until a cure. So I think in district advocacy every August with this army of people that are on this call today and the nearly 1,000 who will receive the video transcript of this call are an incredibly important component of our mission. And as the chair of the ALS Association, I want to thank all of you for your participation today, and as you continue to further the cause with your local congresspeople on behalf of the ALS Association and all of the pals and cows that we serve. Thank you.
Thank you, Scott, for that inspiring message. Hopefully everybody on the call is fired up and ready to go out and take action. As was mentioned earlier, all the resources that were mentioned during this call will be made available. So go to als.org to find what you need for your advocacy efforts in the coming weeks. In addition, the webinar has been recorded. It will be shared momentarily, so you can share that with folks who maybe weren't able to join this afternoon, or share with a friend and inspire them to take action as well. As we wind things down, I want to again thank our sponsors who made August Action Month happen. That would be gold level sponsors, Amylyx, Biogen, PTC Therapeutics, and Cytokinetics. In addition, I want to thank again our silver level sponsors, Apellis, Genentech, Neuroscience Therapeutics, Mitsubishi Tanabe Pharma America, and Sanofi. With that, good luck this month. We're going to hear one last word from Victoria Purdom.
And Victoria battles ALS. How one woman is hoping to help others by taking her emotional battle with this debilitating disease public. Hello, and thanks so much for joining us on this Sunday for Total Maine. I'm Steve Minnick. You may know it as Lou Gehrig's disease, ALS. There is no cure for this deadly disease, which affects a person's motor skills. It's amazing. We have met a woman from Lewiston with ALS. It continues to be an emotional battle, but one that Victoria Purdom has opted to take public. She calls it Victoria Battles ALS. Kathleen Jordan has her story.
You know, it's a constant battle. And you just keep losing muscles in this disease until you're paralyzed. But your brain still works.
This is Victoria Purdom.
Yeah, oh, and dog toys everywhere.
She was diagnosed with ALS in May of 2022 after taking a genetic test.
And that, along with the drop foot, was the diagnosis for ALS. And I had been hiking like March 2021 in Acadia, and I've noticed my foot didn't raise up like it should.
Her life and her wife's life changed drastically just in a year.
Before this, man, I was like a worker. I could work her under the table, like work outside all day, work in my garden.
She was president of her motorcycle club. She worked with the Pink Tulip Project at UMaine to fight breast cancer. And she was so fit, she rode an electric bike from Bangor to Orono for work, was actually pulled over going 40 in a 35.
I climbed Katahdin 6 times. I did the trek across Maine. I was very, very active and healthy.
Now she can no longer go downstairs and needs help getting room to room.
It's taken a lot from me. I can't ride bikes anymore. I can't walk far. I can't bend down. You know, it takes so much from your life.
But she isn't letting this take her voice.
Today was the first day I could not get my feet over the tub.
Last fall, she started a YouTube page called Victoria Battles ALS to show people what the disease does.
I just really think that the more people know about it, the more research will be done and there'll be a cure someday.
Hi there.
It comes naturally. Broadcast runs in the family.
My grandfather I'm a grandmother in radio when I was in radio. I got my groovy scooter bag and
she keeps a good attitude, and to me, she's my hero. She just wants to live her life and does anything and everything she can to do that.
Victoria's wife, Trudy Chase, retired as a physician to take care of her full time.
She is the greatest caregiver I could ever have.
Communication is a key, because mentally this is very difficult.
Anybody could be part of your support group.
Victoria's message to others: ask for help. She has a friend working to build her a ramp to make her porch accessible on her scooter. And a local company is working to get her a van that can carry a powered chair, which typically costs thousands of dollars. Together, they're taking this one day at a time.
Yes, we know where this is probably going, but we still have hope.
Victoria is taking part in a clinical study from Mass General Hospital, and she's on 3 medications approved by the FDA. These are supposed to slow the progression of the disease, but right now, medically, nothing will stop it.
Just started that today.
But as this disease progresses, where it's taken so much from me, we talk frankly about, if I need to be in a hospital bed, well, we're going to get 2, We just got married in 2019. We wanted 30 years together at least. And that's the hardest thing,
For Total Maine, I'm Kathleen Jordan.